Here again is the general workflow for MEG data acquisition. This module will follow the workflow for recording spontaneous, awake and asleep MEG, EEG. The guidelines presented here are according to the ACMEG's Clinical Practice Guideline 1, Recording and Analysis of Spontaneous Cerebral Activity. They recommend to perform the following recordings from a patient. Record awake spontaneous MEG, EEG. Record sleep state spontaneous MEG, EEG. Record additional states as requested, for example, hyperventilation. Position the patient on the couch. Make them as comfortable as possible. Set up the room for sleep. For example, dim the light, cover the patient with a blanket, add a bolster under their knees and secure the patient with belts. Instruct the patient to relax and lie still. When appropriate, encourage the patient to fall asleep. Load the saved acquisition settings for spontaneous recording. Acquisition settings should be prepared in advance, then saved and loaded just before the spontaneous scan. Consult the Megan Guidelines to MEG data acquisition for preparing the settings. Select Go. This will start the flow of channel data to the raw data viewer. You will immediately be presented with a dialog box asking you if you wish to perform an HPI measurement. Before measuring the head position, quickly browse through all the MEG channels using the channel group selections in the raw display. Assess any artifacts due to breathing, movement and muscle tension, and guide the patient to relax and remain still. Check for bad channels and try to resolve any issues before starting the recording. Now instruct the patient, scan is about to start. Relax and try not to move. When the subject is settled, select Measure. Performing the HPI measurement is a best practice and should always be performed. This will measure the current location of the patient's head inside the helmet using the HPI coils positioned on the patient's head. Check that the coils were detected with a goodness of fit that is greater than 98%. If one coil is not well fit, the coil is placed too low on the head and outside the helmet, or it is not well oriented flat against the head. Check that at least 3 coils are available for head position measurement. The coil pair differences show the distance between the coils when digitized and the distance between the coils during this fit procedure. Large discrepancies in these pair differences may indicate that the coil has moved. Check that the differences between the good coils are less than 5 mm. A minimum of 3 acceptable pairs is required for head localization. Check the location of the head origin and ensure the patient is properly positioned in the helmet. Ideally, the Z coordinate should be within the range of -40 to -60 mm, depending on the size of the patient's head. A Z coordinate greater than 70 mm indicates that the head is too far out of the helmet. Make any necessary adjustments and repeat the measurement if needed. When satisfied, select Accept. This information will be stored in the resulting FIF file when a scan is saved. If using continuous head position measurements, select CHPI, then select Record Raw. Inform the patient the scan is starting. The patient must be continuously monitored during the recording. Any clinical events and patient states should be logged for review during interpretation. Avoid loud chatting and other noises outside of the MSR because they may be audible to the patient. It is recommended to record about 10 minutes at a time. After 10 minutes, select Stop. The dialog will prompt the user to save the raw responses. This will save the raw data, which will be processed and used for localization. If the patient is not sleeping, instruct the patient that the scan has stopped and they can relax. Triax Neo intended use. The Triax Neo is intended for use as a magnetoencephalographic MEG device which non-invasively detects and displays biomagnetic signals produced by electrically active nerve tissue in the brain. When interpreted by a trained clinician, the data enhances the diagnostic capability by providing useful information about the location relative to brain anatomy of active nerve tissue responsible for critical brain functions. Indications for use. The Triax Neo non-invasively measures the magnetoencephalographic MEG signals and, optionally, electroencephalographic EEG signals produced by electrically active tissue of the brain. These signals are recorded by a computerized data acquisition system and displayed, and may then be interpreted by trained physicians to help localize these active areas. The locations may then be correlated with anatomical information of the brain. MEG is routinely used to identify the locations of visual, auditory, somatosensory, and motor cortex in the brain when used in conjunction with evoked response averaging devices. MEG is also used to non-invasively locate regions of epileptic activity within the brain. The localization information provided by MEG may be used, in conjunction with other diagnostic data, in neurosurgical planning. This demonstration video was prepared according to Megin's Guidelines to MEG Data Acquisition. Please refer to this document for additional details and safety information.